Polyangiitis. Wait, Granulamatosis, Polyangiitis.
Jay.
My name is Juliana, and I have a form of vasculitis called Granulamatosis with Poliangiitis, which is presented with sudden hearing loss, vestibular dysfunction, eye dysfunction, and a saddle nose deformity. Sometimes granulomatosis with Poliangiitis, or GPA, can affect the kidneys, can affect the lungs, can affect the airways. I have a version that affects my sense organs up here.
Why are you asking questions?
Ask us some questions here, buddy.
Granulomatosis
with Poliangiitis. It's an autoimmune disorder that attacks your blood vessels. A constricting, a tightening, a strangling. I feel like things on my insides are being strangled to death. These like amorphous hands coming in and my little inner ear is like, no. I think the first symptom might have been back in my early mid-20s. I woke up and my nose was a little tender, and of course I didn't think anything of it. And then over the course of the next few days, my nose started swelling. And then that swelling spread to between my eyes, which then spread up and down. And sort of by the time it was spreading, I was like, oh, I have no idea what's going on with my face. But pretty soon the pattern was my nose would bleed a little bit, just a little bit. Just when, when I blow my nose, there's blood, not like gushing out of my face. And then I showed up to the urgent care, sort of saying, this happens to me a bunch. I don't know what causes it. And literally the person wrote, like he discharged me maybe with some ointment, and his notes on my, I don't know, it's called after visit summary. It was like in all caps with exclamation points, don't pick your nose. Or no, it was keep your fingers out of your nose. Which is now permanently on my medical history. And then pretty much, so that's the story of like my 20s into my 30th year, I think. It was just these facial swellings. The first instance of symptoms that the doctors are directly linking to GPA was my 8th month of pregnancy. I was staying at my parents' house and I woke up and things kind of sounded a little funny. When I first woke up, I don't know how I knew that because I was totally alone. But somehow I had the sense that like, oh, things are sounding different. But when I sat up, I was like, whoa. There was just like a whoosh of like, oh, hey, the space is not where I thought it was. This was a cabin outside my parents' house. So I walked to my parents' house, and in that walk, realized I was very unsteady. And I got in, and that's when I started talking to them, and their voices were coming back sounding like little chipmunks. Hey, how you doing? And that kind of stayed the same. So the chipmunk thing kind of was how it was, but my balance turned into dizziness. The world was spinning. It wouldn't stop spinning. I've had that before when you drink too much and you get the spins. I just got horizontal on the floor and I stared at a spot and it was still spinning, and I would just try to like stare at that spot and not let it, bring anything up. And then if I had to get up to pee, I would vomit like multiple times because I was so dizzy. I remember following up with my primary care, and she sort of took a look at my ear and said, oh, you know what, it's probably just water back there. I'll give you some Benadryl. So in the meantime, my hearing is still weird and getting weirder. My balance was really bad. And then I went to this ENT, just paid out of pocket to see this ENT. He took one look at my ear, I think, the line had been that you might have water behind the ear, and I've been taking Benadryl, and he took one look at my ear, and he was just like, go get a hearing test right now. I don't think there's water. I think this is something else. And so I was like, oh, okay, all right, fine. And I went to a Blue Sky Hearing, an audiologist in Berkeley that day, and they tested me, and I had zero hearing in my left ear. I couldn't even hear the faintest thing. I sort of remember, they hooked up my ears, and I did my right side and the left, and I was just kind of waiting for something, and it was a while of waiting. And then the audiologist was very nice, but she opened the door, and she looked so sorry for me. And I didn't have enough information yet to be sorry for myself. So that was sort of the first inkling where I was like, you just heard presence walking in. I was like, oh, it seems like something's wrong. At otolaryngology, they basically were like, okay, this has happened to you. You've had sudden hearing loss. It's something with your inner ear because you also have this balance disorder. They gave me an MRI, and they said it basically looked normal except for inflammation around the nerve leading to the inner ear. They gave me some blood tests, which just showed I had a lot of inflammation, but nothing else. Then I had my baby. I gave birth. And about 5 weeks later is when I went to a doctor's appointment and drove back home. And I remember taking a turn right before pulling up to the house, and I remember feeling like, ooh, that was weird. And then I think I walked in, and I was walking through a hallway, and I all of a sudden just careened into the side of the hallway and thought, oh, that's weird. And then I don't remember after that. But I do know what happened on my right side. It started happening, but I don't remember after that how it appeared. I just remember, I think the next thing I remember is just a whirlwind of appointment activity. I think I had to immediately go on a high dose of steroids. I had to immediately get some shots of steroids through my tympanic membrane. And I think I could see it happening on a camera. And it's so small that you see this big needle coming in, and just it looks like their hand is shaking, because it's so small and so focused in, and you're just that's intimidating. I had my first appointment at the rheumatology department. Pretty much everything came back well, we don't know, but this seems like an autoimmune disorder. So we're gonna say it's autoimmune inner ear disease, which basically just means because of your body attacking itself, your ears are pretty fucked. I mean, mostly I remember personally feeling really overwhelmed. Also at that time, I had a 5-week-old. And so I that's overwhelming. My dad I don't remember at what point he got the news that he was basically going into home hospice, but it was getting there. So I remember feeling just very overwhelmed. I was not sure that any of the medications would work, any of the interventions would work. And so I do remember thinking, I don't know if I'm going to be deaf in 2 weeks. And I remember having to write emails to all my collaborators. I think I was in several bands at that point, as well as my theater company, as well as the kids party company I worked for. I sort of wrote to all of them and said, listen, this is the situation. So there's unknowns in the future. And then I think the biggest thing I was struggling with was, I don't know whether I will ever hear my daughter's voice. And so So I remember like singing to her a lot and just really tuning into her. I had grieved losing my hearing totally. And then after that, it was like, oh, I didn't lose my hearing totally, but my hearing is going to be really shitty. And I do remember listening, you know, and I had such bad tinnitus, I still do, and things are distorted, because I think that's a misconception about hearing loss, is that I think when people think of hearing loss, they think, oh, things are just quieter. And certainly things are quieter for me because I have nothing on this side except for my own little internal like Berlin noise concert going like, but it's not just quieter on the side that has hearing loss. It's distorted. And so things can still be as loud as they are for anyone else. It's just that some of the other frequencies are taken away. So in some ways it's so much harsher. I mean, I guess what it feels like to me is that it's like, oh, things were shitty and I felt like I was in crisis. And then I adapted to it. And then things got shitty and I felt like I was in crisis. And then I adapted to it. And then I adapted to the ongoing shittiness that seemed to mildly be a crisis. And then there was another crisis and it was shitty and I adapted. You know, that's why it just feels like a little bit of a, like if you tell the first part of the story, you kind of know what the rest of the story is. So I have now twice gone through a really long period, a year or more, on 60 milligrams of steroids. In the moment, I can feel the way it flavors my emotions. What the steroids did is it didn't create problems, or it didn't create opinions, but I felt like someone was inside me being like, oh, you're angry, huh? Well, you know? And it was just like, whoa, I feel so angry now. When it's like, I did feel angry, but I wouldn't have felt the fire. What it did, it redistributes your body fat. So it like made my legs really small and like, I guess, put that all on my belly and my face. And that's like hard because I had heretofore been a person who thought I was like not affected by my looks, you know, somehow that I like could be a person in this world transcending vanity. But like looking in the mirror every day and not looking like yourself and you know, my body just changing in that way and not liking it. Yeah, that's hard. You know, the GPA is also eating away at the bridge of my nose. And, you know, it still looks like a nose. It might get more intense. There's more severe cases of it. I don't know if it's progressing there. At this point, it still looks like a nose, but I do just wish I had my nose. The nose that I know. The nose that I knows. I started having some funny eye stuff. It was this eye, and I thought, you know, I was doing a lot of yard work at the time, and I thought maybe I got something in my eye. My eye, okay. I don't know why it's making me angry to talk about my eye. Yeah, basically my eye was terrible and it was really painful. My eye was like very red, looking at any kind of light hurt. Like it just was like, oh, everything was so bright. It also just felt like there was lots of like needles poking my eyeball. It felt like there was knives stabbing all around. I think it felt like intense nerve pain. It felt like someone like put a match and lit that whole thing on fire. It's funny because the hearing loss really affects me socially. It's very relational. I get tired. I get social fatigue a lot. I walk around not knowing whether people are talking to me, especially with masks and stuff. but it's very relational. The balance disorder is present like every second of every day. And it feels like it's gotten a little easier over the years to a degree. But it feels like every second of every day I am having to voluntarily will the fractured pieces of the world back together so that I can, make some sort of like attempt at standing upright. A lot of my brain space had to go towards just being able to be upright, and that it was relentless. Maybe not while I was sleeping, but every second of every day. And it's still like that. If I turn my head, it was worse before, but still when I turn my head, it's like a shaky camera, and if I close my eyes or the sun's in my eyes, I don't know up or down. I definitely rely on feeling the minute angles of the ground. That's why I like to be barefoot or have like really minimal shoes, so I can sense slight angle or texture difference in the ground. I'm also really good at falling from being an acrobat. The last time I freely and joyfully jumped in the ocean was when I was 7 months pregnant in San Diego. I had somewhat stabilized. My body had recovered from childbirth. And I remember also like my father had died. And I remember standing in front of this pool and being like, oh my gosh, nothing's holding me back. Like I don't have a giant hole in my ear. I'm not, recovering from childbirth. I can dive in. I just remember so ecstatic that I could like submerge myself, that I could dive underwater. And I remember I dove and I closed my eyes and I was swimming. And then I went to emerge, and there was no I couldn't get to the top of the water, and I opened my eyes and I had no idea where I was. I had no idea what was up or what was down. I didn't know what way I was facing. I panicked. I panicked. I just started thrashing. I just started thrashing and thrashing and thrashing until I could, until I think I felt my arm go out of the water, and I think I just tried to try to find that and more and get towards there. And I was like, I really thought I was going to die. At a certain point, they were able to look at the symptoms that had progressed. So they went from autoimmune inner ear disease to then, oh, this thing is happening with your eye. Maybe that's related. Oh, you're having this facial deformity. Maybe that's related. And because of the presentation of symptoms and because blood work was showing inflammation was there, they could narrow it down to one of three: GPA, relapsing polychondritis, or IgG4. And those are all vasculitises, so it's more a matter of which blood vessels are being attacked. They're pretty certain it's GPA. They're also like, it could be one of these other two. Doesn't matter, the treatment's the same. However, it's not like I've ever been in a position where I can get a biopsy or a blood test and know definitively, diagnostically, this is GPA. So there's still a little bit of a slight mystery to it, but we're pretty sure it's GPA, and I'm willing to just go with it. Because I do continue to flare, which means, new presentation of symptoms, also continuing to fluctuate my hearing. I was flaring on the azathioprine, so they've moved me to rituximab, which is a medication I get through my veins every 6 months. To be honest, I don't know that much about it. I think it has something to do with mice, which is why I've gotten allergic reactions from it. The only time I've ever had like anaphylactic response, because I think there's something to do with mice. I don't know, I like thinking that I'm somehow like turning into some like mouse woman, or, you know, it's my like superhero name. Yes. Please God, let's not talk about medical bureaucracy. So many precious hours on hold. I have no idea why anyone gets GPA. I do think stress causes inflammation. I don't know that it's enough to create the existence of GPA, but certainly I think stress and sort of more emotional events and how you respond to them, I do think it impacts maybe how it's presenting, the severity of it. And I say that because I can look at this period of my life where it happened and see how stressful events were surrounding it. And it's something similar that I think I've seen in some other stories that I've read. If there's a genetic component to it, I don't think they know, but I don't know whether they know. I'm familiar with, like, in terms of autoimmune disorders, the hygiene hypothesis, and the idea that living in a really sterile culture, a really hygienic culture, or like the theory is that might cause immune systems to redirect towards itself. A lesson I'm continually learning is that patience is dynamic, not static. I am patient some days. I am impatient other days. It's a lot of discomfort. My illness doesn't care whether I'm patient or impatient. It just keeps going, and life just keeps going. So whether I have patience or not, things happen, and eventually I catch up and settle down and move on myself. The word disability, it seemed like a very accurate word for a very small set of experiences. And I now know it's like an accurate word for one tiny aspect of a vast amount of experiences. There's so many different lives and people and situations within the experience of being disabled or being chronically ill. When I think of myself before all this, I think like, oh, what an innocent, dumb little girl who didn't know anything about anything. And, you know, that sounds cruel when I say it. But I both want to, in some ways, get better. You know, I'm still searching for like, oh, if I change my sleep, will that help my day-to-day? Is if I change my diet in this way, is that gonna impact the inflammation in my body? I am on rituximab, which is like a very intense chemotherapy. So I put effort towards getting better. And maybe if you had asked me, like, the first month, oh, here's this button, just press it and this will all go away, I would have been like, sure, let me press that button. I don't know that I certainly don't think I would wish this never happened. And I don't even know if I would want to magically 100% get better at this point, which is really strange. You know, I think about myself before this happened, and I just see someone who knew a lot less and had experienced a lot less, and probably could have kept living without ever knowing this world that opened up to me that is full of discomfort, is full of difficulties. So also, there's something really, you know, it's a little bit like a state of grace too. Knowing it's my own private little world that's mine, and so few people will experience it. That could be isolating. It could also feel really special to me sometimes. Granulamatosis with the Poliangiitis, granulamatosis with the Poliangiitis, granulamatosis with the Poliangiitis, granulamatosis with the Poliangiitis, granulamatosis with the Poliangiitis. How do I cope?
What does cope mean?
how do I get through it? How do I deal with being sick in a way that keeps me going? Partly I have a really entertaining child in my life who needs things, and so I must provide and deliver.
That means it's the end of our turn.
Oh, done. Cut.